He's 28 years old, and for years he's been hiding his chest behind layers of clothing. But today, we're following his entire journey from the operating room to his life-changing result just 48 hours later. My name is Dr. Kennedy Tersi, and I founded Two Palms Medical Center. We are a men's-only cosmetic surgery practice based in Southern Texas. We've made it our mission to focus exclusively on gynecomastia surgery and male aesthetics. If you'd like to learn more, feel free to check out our channel. But in this video, I'm going to walk you through our patient's journey and provide a little bit of teaching points about gynecomastia itself. So to start off, can you tell us how old you are, how tall you are, and how much do you weigh?
Yeah, I'm 28 years old. I'm 5'11", and I'm 216 pounds.
And how old were you when you first noticed you might have gyno?
Right around 13 to 15 years old, like puberty age, freshman year of high school kind of thing.
And what made you realize that it's not something normal?
I lost a lot of weight. I was 220 pounds at my heaviest, like sophomore year of college. And then I got down to like 150, and I just wasn't losing weight from the area, reading all about training and losing fat, and no such thing as, spot reducing fat in areas. But even with losing fat everywhere else in my body, it was like, this isn't going away. And then I was like, well, I've read a lot of places that after puberty, a lot of people lose their, pubertal gyno. It didn't go away after college. And so I was like, well, I probably, need to do something about it.
Good morning. We're about to start our gynecomastia case for today. On physical exam, he has pretty firm, palpable gyno glands. If he flexes his pec and relaxes and flexes, you could see the contour of his lower pec where I'm putting my finger, and the volume he has is actually below his pec. So by removing this mass, you're going to finally see the inferior aspect of his pec margin, which is a lot of the goal for this surgery. His areolas, I do think are going to shrink and darken. So he's a really good candidate, and we're about to get the case started. First, I'm going to mark him up. So we're going to make our typical axis points at the 3, 6, 9 o'clock position. We're going to make our sternal notch and go across. We're going to mark out the inframammary crease, which is the inferior margin of the anesthetic we're going to place. And if he raises his right arm, I'm going to make the axis point in the armpit hair so it's nice and concealed. And then if he lowers his arm, this is his lateral pec margin. And if he flexes his pec again, we can see pretty well the superior aspect of the gland. So this upper dotted line is going to be the superior aspect of the anesthesia. So he's a pretty big guy, so it's going to be a pretty big surface area that we're covering with the anesthetic. And as I palpate more deeply, this is the actual mass itself. I'm just demarcating it as kind of a roadmap intraoperatively. Okay, and that is pretty much our roadmap for his surgery. I break the workflow of the surgery down into 3 broad steps: patient preparation, liposuction, and gland removal. In terms of patient preparation, what I'm talking about is cleaning the patient's skin, sedating them, and anesthetizing them. The sedation and anesthesia is often mixed up. People have a misconception that anesthesia is sedation when they're 2 separate processes. Sedation is a spectrum of sleepiness. The more sleepy you are, the more sedated you are. And our goal is for the person to be comfortably drowsy. If they fall in and out of sleep, that's perfect. If we hear them snoring, we know mission accomplished. And at this level of sedation, usually people are a little bit fuzzy. Their recollection of the day of surgery is a little bit limited because it does cause a little bit of amnesia. In terms of the anesthesia, that's the process of controlling pain. And the way we control the pain of the surgery is by numbing the target area. In this case, that's the chest. And we accomplish this with a solution of liquid that contains lidocaine. And that lidocaine blocks the sensory nerves from sending signals to the brain. So the entire chest is numb throughout the procedure. Once the patient is sedated, the skin has been cleaned, and we've anesthetized the chest, then we move on to the liposuction aspect of the case. The liposuction for gynecomastia removal surgery, sometimes it's not so much for fat removal. Sometimes it's part of the workflow to separate out the gland. And the way we're separating out the gland from the structures on top of it and underneath it, which would be the pec muscles below and the skin above, is by disrupting the connective tissue around the glands. The way we do that is with this ultrasound probe. It's a tool that vibrates at a specific frequency that helps to disrupt those connective tissue connections, liquefying them along with some of the fat around the gland. Once that's all been liquefied, we go in with a different instrument which suctions out that liquefied content. And at this point, a lot of that connective tissue has been broken up, and it'll make the subsequent resection that much easier, and it'll have a smoother contour. So the final aspect of the surgery is removing the glands itself with sharp and blunt dissection. Blunt dissection is when you use your finger or a blunt instrument to kind of break up those remaining strong connective tissue bands around the glands, while being careful not to damage or traumatize the skin above or the muscle below. And for the very strong attachments, we use our surgical scissors, and we carefully peel off the gland from its attachment behind the areola. And we want to be careful here because if we thin out the areola too much, then the skin could fold or crease, or there could be a visible surface defect that catches the eye. So the ultimate goal of the surgery is to remove the gland without damaging anything around it and without creating any signs that surgery was done. In addition to the 3 steps I mentioned, the final step would really be closing the case. And in this case, we did put in surgical drains, and then we sutured closed the access points at the areola. And here's our patient the following day. He's in his compression garment. You could see him taking it off. Here you could see me taking off the adhesives over the surgical access points over the areolas and the armpits. And in his case, he did not have that much fluid output into the surgical drains, meaning it was okay for me to discontinue them, aka remove them. Some guys tolerate this better than others. For most of the guys, they really don't have much of a problem. But for the guys that do feel something, they will describe it as a little bit of burning as the silicone tubing is exiting the skin access point. This is him after the first day of surgery, and this is him on post-op day 2. That's better. So we are 1 day post-op, and you just saw your results. What do you think?
I'm very happy. It's totally different to be like waking up and not having what I'm totally used to looking down and seeing. So flatter chest in the morning was like I was waking up smiling for it, you know?
Yeah. So we are, I don't know, like 16 hours post-op. Mm-hmm. How are you feeling physically?
No real pain, some soreness. The drains were like a few seconds of warmth, but not as bad as what I understood they would be from the previous interviews and stuff. Not a lot of pain moving around. I noticed I had to like put my steering wheel or myself a little closer to the steering wheel so I'm not reaching so much. But apart from that, just soreness.
Surgery day was yesterday, and this is probably the freshest in your mind that it'll ever be. Mm-hmm. So what do you remember from yesterday?
I felt like I was conscious for a lot of it, and like eyes were closed, but when I would close my eyes, it'd kind of be like dreamlike, you know? Don't really like, I'd hear what was going on, I'd feel movement, but not really pain. I only remember a couple pokes here and there, and then like, once you guys asked me like, oh, did you feel that? And I was like, I think so. So that was it.
Okay.
But not, when you said, did I feel it? It was like, it wasn't pain. It was just like I noticed something. You know?
Do you remember getting the liposuction done yesterday?
I don't think so.
No?
I don't think so. I remember leaving the office. Yeah, I do. But I guess like the time in there, I couldn't tell you if it was 1 hour or 3 hours or what it was. You know what I mean?
What happened when you got back to the Airbnb?
I just immediately knocked out after I had some like electrolyte drink and then took a nap until like 7 p.m. So I slept really good, woke up, and then I think I took an exam. Yeah, I took an exam after, but.
Did you do well?
Yeah, I think so. It hasn't been graded yet, but we'll let you know.
I do not recommend. I do not recommend doing intellectual work, making any big decisions while you're on the sedative.
That's fair. That's fair.
But
At the point when I woke up, I felt totally normal and everything, so that was it.
And this morning, you feel
good, refreshed. I walked a couple miles before. I walked 2 miles and just to get some blood moving, and not to the point of sweating or anything, but just. Felt like I didn't do anything yesterday, so it was good to get moving in the morning. I didn't feel any discomfort from that or anything, so felt like a quick.
All right, we are post-op day 2 with our patient, and he's doing great.
I feel good. A little soreness, like I benched heavy in the last couple of days, but no like real pain.
So now you've gone through this, you're 2 days in.
Yeah.
How has this process been?
Really, really good. It's like relief, is like the overwhelming feeling, I think. Like waking up and, looking in the mirror and not having gyno is like huge. So that has been like a emotional, like weight lifted for sure. And it's still setting in that it's real. So that has been like a huge blessing. So.
What do you think of the results?
Great. Yeah, I couldn't be happier. Genuinely, I was worried about like skin retraction and everything with my case. I do have like stretch marks underneath my armpits and stuff, and I thought that was like indicative of not having good skin elasticity. But it has been, the result of it almost immediately, looking good and immediately retracting. And I think with the help of the compression vest and everything, it's just been better than I could have hoped for.
Perfect. Yeah. All right, I'll leave him alone, and I'll try to get some update photos from him over the next coming weeks so you guys get to see the results beyond just the 2-day mark. I know people want to see like 2 weeks, 4 weeks, 6 months, so I'll try to keep you guys posted. Otherwise, congrats to our patient. Good luck to him, moving on with his life, gyno free.
Yeah, thank you so much.
Amen.
I appreciate you.
And here is our patient 1 month after surgery. He is healing up beautifully. I'm very happy for him. The recovery only gets easier and easier from here. And the final swelling, the resolution of scar tissue, that happens over a long period of time, over the course of 6, 12, 18 months. And for him, he's a young, active guy, so I expect that he's going to have really positive body composition changes, especially in his chest. And I think his long-term result is going to be amazing. This is a very good case. I'm very happy with how it went. Hopefully you learned a little bit in this video. I'm going to be trying to make more educational content like this. If there's anything you want to see or questions you have, feel free to leave a comment. Remember that full consultations with yours truly is free. If you want my opinion, feel free to reach out. If you want to learn more, follow this channel. Thank you for your time, and I'll see you in the next video.